Great. So my name is Dr. Laura Alder. I'm one of the medical oncology thoracic lung cancer doctors at Duke University. And very happy to be talking with you today about lung cancer in women specifically. So I think what a lot of people don't realize is lung cancer is actually one of the very leading causes of death in multiple countries, including in the USA. And the incidence is actually rising specifically in females and specifically in younger females aged 55 or younger, when compared to a similar age in males. And we don't exactly know why this is. There's a lot of research underway to try and see what's driving this increase in this patient population. We know, of course, that women have unique risk factors, indoor pollution, outdoor pollution, secondhand tobacco use, differences in biological and gender differences, and how that can impact both the risk and then for those who already have lung cancer, kind of the treatment outcomes, safety, side effects profiles. But a few things I really wanted to get across today is the importance of kind of recognizing who's at risk. We know the importance of lung cancer screening. And so that applies to anyone who is a current smoker or a previous smoker with at least what's called a 20 pack year history. And so what I like to do is it's basically 20 years or more of smoking, to put it in general terms. If you're 50 to 80 years old, you qualify. And we know from literature that women actually are less frequently even have that conversation with a healthcare provider of knowing what that the lungs cancer screening low dose CT scan exists and is highly recommended, especially women of different racial ethnicities and the such as African Americans, Hispanics, or even lower. This topic is discussed at an even lower rate. And it's so important because lung cancer screenings with these low dose CT scans are very safe to do annually once a year. That's really the main thing that saves lives, in lung cancer. It's how we can detect it very early at an earlier stage before it's had a chance to spread. And it's when we still have the chance to cure, lung cancer. So super important. The other thing I just wanted to highlight is the importance of advocating for yourself. And we know that at the end of the day, patients know their bodies best. And so when they feel that something's not right and specific symptoms, I always tell to be aware of what could possibly be associated with lung cancer specifically is a cough that doesn't go away, that's lasting more than about 3 weeks or so, that could be getting worse. Any coughing up of blood. If you have recurrent lung infections, what's called like pneumonias, that doesn't seem to get better with antibiotics. Any pain with breathing, feeling short of breath that's new or different in the past few weeks. Any unexplained weight loss, or just feeling bad. So important to go see your doctor. And if you're having these respiratory symptoms, ask them, do I need a CT scan of my lungs to give us a better idea of what's going on? Because that's the very best test that we have to have a good picture of the inside of the lungs. And that's the best tool we have for lung cancer detection and screening. So that's so important. And then once we have a diagnosis of lung cancer, one thing I always like to emphasize is the lung cancer field is expanding very thankfully at a really quick rate. We have so many new treatments, so many new therapy options in every stage and line. So both early stage when it's confined to the chest and in late stage or metastatic stage 4 when it's spread to different parts of the body. And one of the things that drives more and more treatment options is clinical research. And the big part of that is clinical trials. And clinical trials are when we can offer new lines of treatment, new types of therapies that we as physicians and scientists are excited about. We've seen some data that they work and could be the very best next line of treatment. And to show that, we tested in large amounts of patients in a very safe way, and either compared to a standard line that's already approved or in some way incorporated with a very well-known standard treatment. But everything we do is always adding and hoping to add benefit. And that's how we drive forward is through this clinical trials, through research, through funding. And we know historically that women tend to be underrepresented in clinical trial enrollment. And I think there's a lot of different reasons for that. Um, Sometimes women have a greater share of taking care of the house, of kids, different familial responsibilities, things that kind of make going to the clinic, make going to some of these appointments a little bit more challenging. But it's so important to have women well represented in these trials and making sure that we as clinicians, we as communities, we as amazing advocacy groups like Lung Cancer Initiative do everything we can to support these women, these patients, these people in getting access to these clinical trials. Because as I mentioned before, we know that women, men, different racial groups, they can do differently. They have different bodies, different makeup, toxicities can be different, dosing can be a little bit different. How well these drugs work can be a little bit different. And it's so important for us to capture all of that information so we can apply it to that individual sitting in front of us in the clinic. Because that's very thankfully how a lot of lung cancer and cancer in general is moving towards this more individualized approach and this whole person approach. That's one thing I always try to incorporate when I'm seeing patients in clinic is let's understand your specific tumor biology and also everything about you as a person, and how we can best meet you where you are, and best give you the treatment that's going to work best with you as a whole person. Um, so clinical trials is something amazing that we can offer, and we're very lucky at Duke and in our academic environment to have multiple clinical trials going on, for multiple types and kinds of lung cancer. And then to get more into the treatment and then survivorship, thankfully, people are living a lot longer with lung cancer, and that's a wonderful and very exciting statement to make. As we see that, we have to make sure that we're meeting these patients and women in particular with their needs. We know that lung cancer has been associated with increased rates of depression, anxiety, can impact the quality of life. And this has been shown to even be more prominent in women compared to males. And these are discussions sometimes that aren't had in clinic. And something that we need to do a better job as physicians and healthcare workers of focusing on, but making sure that as people live longer, they're also living good quality of lives. And that we're addressing things like sexual dysfunction, which, we have a lot of treatments that can really impact that quality and joy that comes with sexual relations with a partner and loved ones, and making sure that this can be addressed in clinic. Dr. Narges Flores does an amazing job at Dana-Farber leading the Young Cancer Initiative and the Hear Her campaign of talking about these things. Their study found that 77% of females have sexual dysfunction. This often goes completely undiscussed in appointments, but it's something that can really impact quality of life. Also discussing depression screening, anxiety, women dealing with children, dealing with families, making sure they're supported, and making sure that their symptoms, side effects from treatments are heard and addressed. There can be weight gain, There can be skin issues. And we want to make sure that we're not just focused on treating the cancer, but we're treating the human and the human emotions and the human experience that we're all going through.